So as a healthcare professional, seeing lots of different types of chronic wounds on a daily basis, I was just wondering what kind of chronic wounds or hard to heal wounds you would have seen in your clinical practice.
I think probably the main ones would be diabetic foot ulcers, pressure ulcers, venous leg ulcers and arterial ulcers.
So the chronic hard to heal wounds that you're seeing can be caused by lots of different factors, like diabetes, chronic health conditions and poor circulation, various different things that would cause hard to heal or chronic wounds. And it's really important that each person has an individualised plan of care to make sure that the treatment then represents what that particular wound is going to need. And some of these plans of care might involve surgery or medication to try and help with the progression of healing. In your practice, how would you look at treatment plans and how would you individualise the process?
I think it comes back to your holistic assessment of your patient and what the barriers to healing are, whether that's something that you could manage with wound care alone or whether it needs to be jointly with either the use of medication and or surgery potentially. Some wounds will require surgery to remove some of the devitalised tissue or rolled edges, which can cause a problem with the wound healing process. So it's very much dependent on what your assessment of that patient is.
So having the right treatment plan for that particular patient's individualised care so that to their wound is really important.
Absolutely.
To create better outcomes.
Absolutely, and every patient that you see should have an individualised care plan. No one patient is the same, no one wound is the same. So you've really got to take into consideration that patient as a whole to be able to manage that wound in the most appropriate way.